Now let's talk about the COVID-19 vaccines. There's some breaking news tonight. A federal advisory panel just voted to recommend that healthcare workers and nursing home residents should be the first to receive the vaccines once they're available. This will become the official guidance to states if approved by the CDC director. So, what else is new on the vaccine front tonight? We have received some questions, so let's go straight to some answers for you. Nicole from Silver Spring, Maryland texted us this question. What are the vaccine side effects? That's a good question. Here's what we know thus far. Of the two leading contenders, Moderna and Pfizer vaccines, the most common side effect was fatigue by nearly 4% of Pfizer recipients. It was nearly 10% for Moderna clients. Headache was reported by 2% of Pfizer recipients. It was 4.5% for Moderna recipients. The latter drug maker reported more side effects, including muscle and pain, joint pain, and redness at the injection site. But here's the good news to all that. The majority of the side effects were short-lived and not severe. Next question. What's the latest on FDA approval of these vaccines? Moderna and Pfizer both applied, as you know, for emergency authorization within the last week. The ball is now in the FDA's court to evaluate and greenlight these vaccines for distribution. Reports say that could come within a couple of weeks. Of course, vaccine approval is only half the battle. The bigger question has to do with timeline and distribution. D.C., Maryland, and Virginia's first vaccine doses could arrive in a matter of weeks. But if you're hoping to get your first dose once they arrive, don't hold your breath. D.C. Health Director LaQuandra Nesbitt said yesterday that the district will only get about 1/10 of what it needs for its health care workers, who will be among the first in line. Now, when it comes to a broader vaccine timeline, right now we just don't know. As more doses are produced and allocated, we'll bring you those answers as soon as we get them. Meantime, continue to wear the mask and keep your social distance to protect your family and your community.